Okay, I think I can just start. And people can just hop in and see. So welcome everybody. Good morning and good night for some of you. I think this is the fourth webinar. I think the last one where we will hear from 3 researchers on incredible work they've done on heat stress, ranging from Indonesia, Vietnam, and India. So I'll introduce myself. I'm Carolina, working at the Climate Center, focusing on heat-related projects. And Ainur will be supporting me today with the slides. I took her job as a moderator today. So some background on this project. I will quickly share my screen to show you this research program. And I will share the links in the chat as well. So last year we announced a research program together with the Global Disaster Preparedness Center of an American Red Cross, the Red Crescent Climate Center, and the Global Heat Health Information Network. So this is a small grant program. We really wanted to support local researchers in low to middle income countries to increase our knowledge on heat waves and their impact on people in their countries. So 15 researchers were selected across 13 countries, many of which were one of the first research on heat stress in their own country. So I think they're really incredible, valuable pieces of work. So the scope of the research, it was focused around 3 main topics. The first was identifying local heat thresholds and triggers. The second one, analysis of public perceptions towards heat. And the last one was to identify strategies to influence policy and action towards risk of extreme heat. So the research of the speakers that we have with us today will focus on the first 2 topics. And on this website, I will share the link in the chat. You can basically read all the research. You can read about all the researchers and download their papers, basically. You can also watch the previous webinars, previous 3 webinars that took place where all the researchers present their work. So let me stop sharing my screen and introduce the 3 speakers we have with us today. So our first speaker will be Dr. Rajashree Kotharkar from the Department of Architecture and Planning at the National Institute of Technology in Nagpur in central India. She will present on heat risk perceptions of informal workers in the city of Nagpur. Second, we will hear from Lynn. She is from the Centre for Environment and Population Health in Griffith University, Australia. So it is midnight for her. And lastly, we will have Dr. Efi. She's Associate Professor at the Faculty of Forestry and Environment at IPB University in Indonesia. She will present on heat risk perceptions of agricultural workers and heat risk communication strategies in Indonesia. So maybe Ainur, you can go ahead and share the slides. So each presenter will give around 10 minutes presentation, and afterwards we will have a Q&A. So in the meantime, if you have any questions, please drop it in the Q&A box that you can, or in the chat, you can click. And then we will have a discussion afterwards. So if everything's set, I'll give the floor to Rajashree. Thank you.
Okay, good evening, everyone. And I guess for some people, it's good night also. So I welcome you all for this. And a big thank you to the funding agency for providing funds for this study. The background of this study is like we were already working on heat action plan and measuring heat stresses. And most of the work that we were doing was largely very technical and very science-based. So we generally wanted to know as to if at all, once you have a policy in place and you have solutions, will it work with the communities? So what we decided was, that we'll kind of assess the heat risk perception of the informal workers, because informal workers are the most vulnerable group when it comes to the overall vulnerable population. And secondly, their exposure is very high since they have to work in the outside for their livelihood. So informal workers were chosen. And this study is based in Nagpur, which is a kind of a hotspot in India. So it's a very heat-prone city. Can we go to the next slide, please? Can we go to the next slide? Yeah. So we decided that we'll focus on informal workers. And while there were 2-3 things that we wanted to do. Try to understand what is the level of risk perception among people, among this particular vulnerable group. Secondly, if once you know that they perceive extreme heat as a risk, what are the other factors that have a relationship with the heat risk perception? That was the first part. Secondly, we were also trying to kind of understand the neutral PET we were trying to calculate, whether they are comfortable with higher temperature or not. That was also since their exposure is more, we also wanted to know that. And lastly, we wanted to know the kind of modifications that they do to their workplace as an adaptive measure. And once we have all this, we tried to understand, collectively as to how each one of them was trying to do it at individual and community level. Ours was a team of 3 people. I am Rajashree Kotharkar and I was the principal investigator. And there were 2 more members to this team. Sagar was there, who was a research intern. He's a student of undergraduate student at my department. And Sanyukta Shah, who was a project staff on this particular research project, and she's an urban designer. Can we go to the next slide, please? Yeah. So this, as I said, that the study had to be in the city which was already heat prone, and this social group which we had chosen had to be a group which was very vulnerable. And we chose vendors basically from the informal markets. The reason being that their exposure was more, and since they had that exposure, there was a possibility of them bringing in some changes, modifications as an adaptive measure maybe. So that was done. So we kind of identified there are something like different levels of informal markets in Nagpur. So we chose 3 different levels. One was at the city level, then rather a zone level. Second was at the neighborhood level, and third was at a kind of a street level where you have just couple of structures. And that was one. Secondly, so overall we had something like 14-15 markets which we had to cover. And this was also done. And so all the 3 types of markets were covered. They were initially mapped, the drawings were made. We tried to do the documentation of how people were doing, selling, all that, so that one gets an idea as to how the whole setup works and how people, what is the duration, what kind of things are they selling, and how many people are there, all that. And it kind of gave us some kind of a background as to most of the people were men, and most of them were basically selling the things related to clothing and vegetables. So kind of it gave us a good perspective and good understanding of the overall group of these these basically workers in the informal markets. Then we went ahead and can we go to the next slide, please? Yeah. So what we did was the study was divided in basically initially 2 parts. That the first part was we were assessing the heat stress, where we used a particular kind of a weather station to measure the macrometeorological parameters, and simultaneously we were conducting the outdoor thermal comfort survey. Secondly, we were doing the heat risk perception study, which is again survey based, wherein we surveyed something like 450 people throughout the day. And thirdly, we kind of mapped, if you can see here, there is this thermal image which kind of shows the impact of the adaptive measure that someone has taken. What kind of temperature profile can you see under that particular shade? So this was also done using various means of documentations were used. Thermal camera was used, and the surveys were conducted. When we conducted the surveys, there were four major domains under which we were collecting the data. The first was demographic, wherein we tried to understand the balance of kind of a gender, age, what is the income group like? I mean, what kind of incomes do they have? What was basically the selling, those kind of things. What is the education level? Which there is a possibility of that affecting the perception related to heat risk. Then the second one was the knowledge and awareness regarding the heat wave. What was the basic knowledge that they have, and what level of awareness do they have about the extreme heat? Thirdly, we listed kind of heat risk perception parameters, which were like whether they are aware of the frequency of heat waves, what is the level of, what kind of temperatures do we have here? Do they expect it to get, have they kind of observed that has it been getting warmer? So those kind of things, that whether they are observing the extreme heat phenomena, that was also done. And lastly, then we documented the adaptive measures, and adaptive measures were divided into two parts. One was the physical, which was documented, and the other was lifestyle changes that one makes during the extreme heat time, in terms of changing food habits or the clothing style, all those things. So that was also done. And lastly, then we tried to understand the relationship among them. Now, what were the challenges? The challenges were like, typically in India, the summer starts somewhere in March and it kind of gets over once the monsoon sets in the first week of June. And then the weather is really, I mean, you cannot call it typical summer weather. So one issue was, since the grant was declared in the second week of May, we had to kind of use the remaining time. So we had to schedule the surveys in a given time. So that was one of the challenge. Secondly, the outdoor thermal comfort themselves are a big challenge, because one has to be in 46, 47 degrees Celsius outside, and the person who's giving responding to the survey also has to stand with you in the heat. So that becomes a little tricky. Thirdly, the extreme heat itself was a major challenge. As I said, it was like, for last year, it was it was extremely hot last year's summer, and it was very long also, and many heat wave days were also there. And there was a reluctance among the vendors to talk so much, especially in terms of health, because that is typically an area where nobody wants to talk much, and the economics, in the sense income. Nobody wants to divulge too much about the health and income. So that becomes a very tricky area. I think it will remain like that for every researcher, even in future. Can we go to the next slide, please? So I would say the findings were basically, so we kind of, first was we tried to understand what is an overall heat risk perception index that we got among these vendors. So it was quite good, 7.2. Whereas the migrants typically had a very low risk perception of heat risk. Then thirdly, what we observed was that the demographic factors like education is supposed to have a relationship with the perception of risk. Higher their education, better is the heat risk perception. But we didn't find anything. Thirdly, the women are supposed to be vulnerable, and since they are vulnerable, they're supposed to, and there are studies that say that they have a better perception of heat risk. We didn't observe that. maybe because the sample size, I mean, there were very few women outside as informal workers. Majorly, it was men-dominated livelihood, I would say. The locals had an idea of extreme heat because in traditional, typically in Indian context in this particular region, the heat wave is also called as now tapa. Tapa means the extreme heat, and for 9 days there is an extreme heat period. So they are well versed with the concept of extreme heat, not through the modern science but otherwise also. And what we have seen that the extreme heat has a major impact on employment. Secondly, the income. It adversely affects the employment and income. It adversely affects the productivity. And it also leads to increase in expenditure. That is a major observation that has come out. They feel that the frequency and severity of heat wave has increased. They themselves consider that they are vulnerable. So all these things were observed. So this study is really necessary. Secondly, the kind of adaptive measures that people took, mostly there were a lot of lifestyle changes that people did. 66% people responded, I mean, made some changes. When it came to making a change in the workplace, most of them went for a kind of a, green net for shading. And what we realized, their choice of adaptive measure depends on the economic feasibility of that particular measure. Secondly, they have no knowledge of which one really works for them. At times, they are using tin shade, which is working adversely. So that is one area which is pretty gray, where there is a need for people who are experts to come in and essentially do something about it. I guess only 2 minutes are left, so we go to the next slide, which is the last slide. So the recommendations, I would say that more studies will be required, more so where the impact on economics, I mean livelihood and economics among the urban poor is something that needs to be addressed, that needs to be taken up. Secondly, we don't have the documentation and development of best practices, which are very location specific as far as the adaptive measures are concerned. Like I said, they are doing it, but all those measures, they don't work. At times they work adversely. Thirdly, there are a lot of things in the traditional knowledge, and there are measures that exist in the traditional society. Because if you see, this part of India has historically been very hot. So generations have already had some way of solving this problem. Somehow, either it should get handed over to the next generation or you need to document it systematically. So that needs to be done. There has to be a strong focus on improving heat risk perception when you want to, if this is something, a suggestion that can be given to NGOs or community, people who work with the community, and improve the heat risk assessment among the all possible vulnerable population, because that is strongly linked with, even if you are taking measures, but if the perception is poor, then it's not going to work. So that's something that works. Thirdly, we have so many policies and plans in place when it comes to managing and planning for extreme heat in urban areas, or for that matter, all the settlements. One of them is a heat action plan. So I feel that we should integrate heat risk perception with the heat action plan, which will be a major contribution towards the policy. And lastly, more studies are required in this particular field, because this is something where not much work has been done in this part of the world. Thank you so much. I hope I finished in time.
Yes, thank you so much. That was super interesting. So for all the participants, please put your questions already in the Q&A and we'll go over them in a bit. I was wondering, just a quick question, is Nagpur suffering at the moment also from extreme heat? Like many
right
parts
now it's raining in Nagpur. Okay. So we don't have a the classical summer has not set in this year. It's been the weather over here has been quite different throughout the summer. Rather, the February was much warmer than March. So we're still waiting for the summer to set in.
Yeah, and the vendors, they're all out in their markets then, I assume.
Yeah, right now, suddenly people must be prepared for extreme heat and it has started raining. So it's a different kind of ability to adapt, maybe that right in the middle of summer you have rains. So it's a different.
That is strange.
Yeah. Okay.
Well, thank you so much for your presentation. We'll go over some questions later, but next I would like to welcome Lynn to talk about local heat health thresholds across different ecological regions in Vietnam. So over to you.
Thank you so much. Hello, everyone. My name is Linh. I'm working in the Center of Disease Control and Prevention, CDC, in Hà Tĩnh in Vietnam. But currently, I'm studying PhD the final years at Griffith University, Australia. And on behalf of the team, I'm honored to present the finding of our project, the local heat health threshold in different ecological regions in Vietnam. Next slide, please. The next slide, please. Yeah, the arms of our project is to assess the impact. No, the previous one. Yeah. The aim of our study is to assess the impacts of high temperature on the hospitalization. Sorry, the previous one. The second slide. I think I have problem with the internet. Yeah, still introduce my purpose of our purpose to assess the impacts of high temperature on hospitalization in 8 province represented to 8 ecological regions in Vietnam. And here is our team, and we have 6 members. All of us are the public health researchers currently working in universities in Vietnam and in Australia. The next one, please. Now I would like to give some general information of the research setting. Our study was conducted in Vietnam. It is located in Southeast Asia. Vietnam is one of the most countries that are vulnerable to climate change and extreme heat. Vietnam have a S-shaped, long and narrow countries with a long coastline, and it is a populated country with the density is ranked the second in Southeast Asia, just after Singapore. Generally speaking, Vietnam has a hot and humid weather with an average temperature is around 38 degrees and the humidity is about 80%. And you see the combination of high temperature and high humidities can have extra health impacts because it affects our body cooling system. And according to the Global Climate Index, Vietnam ranked the 6th globally that the most affected by climate change and extreme weather events. And for the next decade, the average ambient temperatures and the number of heatwave events are projected to a significant increase. Meanwhile, the level of climate change adaptation in Vietnam, especially in the health sector, is relatively low. So it's a very high risk of heat exposure and other climate weather events. Next, please. For the methods, our study is using time series analysis that conducted data from 8 provinces. And as you can see in the map, the 8 province representing to 8 ecological regions. And we use data from daily hospital admission and daily weather data with the time span from 5 to 10 years, depend on the availability of data in each hospital. For data analysis, we use Poisson generalized linear model combined with distributed large linear model. Our analysis control for seasonal and long-term trends, the day of week, and as well the humidity index. The next one, please. Here are some key findings from our study. For the first one is for province level effects of heat on hospitalization risk. We can see in the picture the level of effects, the heat effects varied by regions and is different for specific disease groups. And the most of the negative impacts of heat was observed after 1 day exposed to high temperature, and also the temperature threshold that has a minimum risk hospitalization is different across regions and tend to lower in northern regions, while it's higher in the southern regions. And similarly, the health heat thresholds was different among regions. You can see the heat-related hospitalization begin at a lower maximum temperature in the colder regions. For example, for regions in the northern parts, including northwest, northeast, north central, and Red River Delta, the temperature threshold was 26.5 degree, while the central part was 28 degree, and the southern part was around 30 degrees. The next one, please. The next slide. Yes, here this figure show the country level policy effects of high temperatures on all-cause hospitalization and three specific disease group, including infectious disease, respiratory disease, and mental health disorder. Overall, we can see the significant effects of heat on all-cause hospitalization and for infectious disease. However, we can see the significant relationship between heat and respiratory disease and mental health disorder. When we review the literature, the results is quite, it's not consistent across the peer study. And it may be because of the classification of the disease in our group is too big. For example, the effects of heat on chronic respiratories may be different from that on acute respiratories, and also really depend on other characteristics like socio-economic conditions or even the heat prevention practice. The next one, please. The next slide, please. Yes. So the contribution of our study in this topic is is the first effort in Vietnam to compare the effects of heat on hospitalization risk in all the ecological regions, and our study showed the effects of heat on health were the most pronounced on the same days or on the 1 days of exposure to heat. And especially, our study pointed out that the different regions have different temperature threshold, and the colder regions, for example, in the northern parts, has a lower threshold value. This is important. This finding is important to develop appropriate threshold for heat warning system. And also this finding contribute to identify the heat vulnerable regions and contribute to develop local adaptation strategies. However, our study have some limitation should be discussed. Its first one is from hospital data. We only collect the data from province hospital. And some case that they go to the lower level hospital, for example, district level, we are not included in our study because we have some limitation in access the air record. And the second limitation is from the weather data. We only collect the weather data from central monitoring station in each province. It means that individual exposure level may be not accurate assessed due to the variation in weather among suburbs. And the third one is from selection bias, maybe occurs because we only select one province in its regions. So the finding may not represent for the whole region, the entire regions. And we have not identified the heat threshold for specific sub-disease group. The next slide, please. The last slide, yeah. After our project, we have give some recommendation. The first is for some idea for further studies. So it's better if we can consider when examine the temperature hospital relationship. For example, we can consider the emergency visits. It may be more sensitive to changing temperature rather than the general hospital visit data. And it is a great idea if we can have specific analysis in specific heat sensitive disease rather than like the last group. And it's better if we have a further study stratified by the geographies or ecological, socio-ecological characteristic that is better evaluate the effect of high temperature. And another recommendations are for heat unit prevention and heat health action plans is important to emergency service should be prepared to respond quickly to heat related emergency during a heat wave event. And it should be developed a heat vulnerable map that identify the high risk population to provide the timely support. And it's important to improve the quality of digital health and weather data to provide more accurate evidence on the heat health relationship. That is our finding from our project. Thank you so much.
Thank you so much, Lynn, also for that super interesting presentation. I find it so interesting to see that map where you can see the different temperature thresholds, which are quite different across the country. I think that's a very important point because so many countries with a warning system only have one that's based on one threshold, right? But in many countries, there are climatic differences and there's a need to understand local thresholds so that the warning system can be more appropriate for that place. So super nice. If people have questions, put them in the chat, and then we will go on to our last presenter of today, Dr. Efi, who will talk about the climate change impacts on occupational health of Indonesian farmers and forestry workers. Please, the floor is yours.
Thank you. Thank you. Hello everyone. I am Efi Yuliati Yovi, and today I'll be presenting our research on the impact of climate change on the occupational health of Indonesian farmer and forestry workers, and we'll be discussing their knowledge, risk perception, precautionary behavior, and communications. My team includes Dr. Budi Kuncahyo from IPB University, and Dr. Anindriana Stiti from Bandung Institute of Technology. This research was funded by the Global Disaster Preparedness Center, GDPC, of the American Red Cross, and supported by Climate Center and Global Health Information Networks. And our finding over valuable insights into the challenges these workers face and measures that can be taken to mitigate risk. Thank you for joining us, and I'm looking forward for your questions and comments. Next slide, please. The IPCC, Intergovernmental Panel on Climate Change, estimate that the global temperature increase more than 1 Celsius degree from the last century, and Indonesia is among the most vulnerable nations to extreme heat, in which agricultural workers are particularly susceptible to health problems that endures due to their outdoor works. In Indonesia, we have 33.4 million workers employed in this industry. This is equal with 12% of our whole populations. Supporting these workers through awareness and tool is crucial, but lack of information on health complaints and underlying issues can hinder prevention programs. Next slide, please. Next slide, please. Okay, thank you. So this study collected cross-sectional survey data taken between June and August 2022 in significant rice producing or active forestry regions of Banten and Central Java provinces. Questionnaire with at least 110 questions was developed, and face-to-face interview was conducted with illiterate interviewees. 215 paddy farmers and 210 forestry workers, and at least 97% of participants in both groups have not received any occupational safety and health training, especially regarding to extreme heat exposure. And majority of farmers were seasonal workers, while the majority of forestry workers work for fixed employers. The participant in both groups lacks access to basic facilities like workhouse or closets. So this is, they also have a relatively low educational background, and for forestry workers dominated by male workers. Next slide, please. Next slide, please. So this is the instrument of my study. In order to gather the necessary informations, the question asked to the participant were adapted from various concept and research findings. For heat-related knowledge, we use a questionnaire that is developed based on hot habits, and also a questionnaire from the study of Rico et al. 2020. For the risk perceptions, we use the psychometric paradigm concept proposed by Slovic. And in the study related to knowledge, risk perception, precautionary behavior, actually there are 5 hypotheses that we can see here. Hypothesis 1, heat-related knowledge positively predict precautionary behavior. Hypothesis 2, heat-related knowledge positively predict risk perception. Hypothesis 3, risk perception positively predict precautionary behavior. Hypothesis 4, risk perception mediates the relationship between knowledge and precautionary behavior. And the last hypothesis is that participant groups, paddy farmers or forestry workers group, moderates the relationships between knowledge and precautionary behavior. Next slide, please. Next slide. Yeah, thank you. We use several approaches for the analysis, including both descriptive and inferential statistic, validity and reliability tests conducted to select data that can be analyzed for the further process. using both non-parametric statistic, the main with new test, and then structural equation model with the partial least square. This is especially a focus. We use the SAMS PLS to analyze the correlations amongst knowledge, risk perception, and precautionary behavior. Next, please. Next, please. And it seems that's a kind of thinking of problems, but I will go. Yeah, okay, thank you. And because we have time constraint for this presentation, we will focus on 5 key findings. The first is regarding with the participants' awareness and the heat exposures adverse effect to them. The participant in this study reported the experiencing significant heat-related distress, with the majority of the farmers and forestry workers rating their workplace temperature as 3 out of 4 scale. 4 means very hot, and 74% of both groups reported adverse health impacts, decreased work productivity, which in turn this will decrease also to their income, and lack of access to necessary facilities. And then findings related with the knowledge, risk perception, and precautionary behavior analysis. The finding of this research support the notions that knowledge is a crucial predictor in promoting precautionary behavior. This is hypothesis 1, and that it has an immediate and significant impact on individuals' perception of risk. This is hypothesis 2. Additionally, the study underscores the importance of perceived risk in altering people's behavior in disaster with a gradual onset. This is hypothesis 3. And then this study also reveals that risk perception mediates the relationship between knowledge and precautionary behavior. This is hypothesis 4. And the strength of this relationship may vary across different occupational groups. This is hypothesis 5. And this study confirmed that the emotions of dreads play a functional role in exacerbating perceived risk and is a predictor of positive behavior change. So from this finding, we have an idea that perhaps we can use what we call as a kind of fear language. And then the fourth findings, the study confirmed that the the analysis shows also that the participant group reflecting workers' characteristic and employment status moderate the relationship between knowledge, risk perception, and precautionary behavior. And notably, in Meyer's study, forestry workers are less likely to agree on precautionary behavior, despite their having a higher degree of knowledge, knowledge on heat-related illness and heat-related knowledge, indicating that these forestry workers need more intense support. And then, in regarding to the communication preference, I can say that a majority of the respondents prefer face-to-face information delivery, with 26% preferring visual aids, which is broadcast via TV, YouTube, Facebook, or other social media. They also prefer hands-on demonstrations for the topic of safety precautions and emergency procedures. And also they said that the government officials consider as the more trustworthy sources of information. Next, please. So the last slides. This is regarding with this is about recommendations. The last slide, please. Based on the findings, we recommend several points. The first is that to reduce the harmful effect of heat exposure on the health and well-being of Indonesian paddy farmers and forestry workers, it is vital to encourage precautionary measures. This can be achieved by improving their knowledge of heat-related risks and enhancing their risk perceptions. However, certain groups, particularly forestry workers, may have mental barriers that hinder their risk perception due to the gradual onset of symptoms. To overcome this, further research is necessary to identify external factors that can alleviate this barrier. While a fair approach may be effective in increasing risk perception, it should be used with caution and tailored to the audience preferences and characteristics. Effective heat-related information communication should involve customized strategies that consider individual, also societal and cultural factors. Trusted authorities should be utilized to increase risk perceptions. And then face-to-face communications, demonstrations, and informal packaging and distribution of information by governments. This is in case of Indonesia. By government agency are recommended as effective ways to disseminate information to Indonesian paddy farmers and forestry workers. Local knowledge should also be incorporated as a source of information. Moreover, we recommend that the programs be action-oriented rather than solely administrative to achieve the desired outcome. So we that
I'm sorry, Efi, I think we're losing you for the last minute.
Contribute to the development of effective heat-related health promotion and prevention programs for outdoors agricultural workers in Indonesia. Thank you for your attention.
Thank you so much.
Thank you.
The last minute, it broke off for me a little bit, but I was able to hear for the rest. Maybe it was my Wi-Fi. Maybe the last conclusion. The last conclusion.
Once more?
No.
Yes, I said that I hope that
Oh, you're breaking off for me again.
Yeah, in Indonesia. Yeah.
Okay, perfect. It was super interesting as well. I found especially interesting that people prefer the face-to-face information. That might be worth thinking about, like how could we provide that face-to-face? What would be ways to disseminate information face-to-face? And of course, the importance of local and societal factors. So now we have around 10 to 15 minutes time for Q&A. So I'd like all the speakers to please put back on your camera. And maybe the first question that is in the Q&A was for Rajashree, I think, in the Q&A. Let me just pull that up. So the question was, how were the responses documented? Oh, I'm hearing an echo from me. Is it?
Are you?
Yes, can you hear me?
Yeah, I can hear you.
Okay. Yeah, so the question was, how were the responses documented? Was it filled out by the respondents or by the research personnel?
No, they were filled by the research personnel, and it was like I said, the questionnaire was based on these 4 domains that we had identified: demographic, and the other 3, which were essentially, one was the knowledge. We also had the same findings that the other study, which also talks about heat risk perception, that the knowledge is strongly linked with the perception of risk. and the third was, what are the variables of heat risk perceptions? And lastly, the adaptive measures. That was divided in two parts, but everything was done by the researcher, not by, because they were actually they were on duty, they were on work. So they were also attending to the customers while you're talking to them. So certainly they will not fill the questionnaire. We did that.
Okay, yes, that makes sense.
Yeah.
Yeah, very interesting what you mentioned, that there's some difficulty sometimes to talk to the vendors, or maybe they don't want to disclose all information about health and income. Do you think this is a cultural, sort of social aspect, something? Why do they not want to talk about it?
No, I think this must be a universal phenomena that none of us
Yeah.
wish to speak too much, because it's a very private domain, talking about your own health. And secondly, income is certainly a very, very private matter. No one wants to talk
For
about
sure.
income. So we had questions like whether it is affecting the income. Yes. Does it affect the productivity? Yes. Do you have, so there is an increase in the expenditure on household front, that means on the home front as well as on the work front. But household, the increase in income in the household is much more than the kind of expenditure increase at the workplace, because sometimes then you don't get involved. You don't spend money on adaptive measures. If you have less money, then you use measures that you can afford. That's one area I would say that where the experts need to intervene and evolve a kind of best practices for adaptive measures which can be used by them.
And to compare them through cost, right? To really see evidence-based.
Yes, so partly we tried to analyze, but the time was very short. That kind of analysis requires time as to how much effect a particular adaptive measure has when it comes to change in temperature and exposure to sun.
Yeah, thank you. Yeah, we have another question in the chat for Lynn. It's Avikosh who is saying very insightful results. For the hospital admissions, did you only take into account heat-related illnesses or also all-cause illnesses?
Yes, our analysis is first for all-cause hospitalization, and we divide in three sensitive heat-sensitive group is infectious disease, respiratory disease, and mental health disorder. And we think for further study is better to narrow down the more specific subgroup. It might be better to identify the effect of heat.
Yes, and also a second question, do you know if Vietnam is working towards any specific heat-related action plan?
As far as I know, Vietnam is already developed the climate change adaptation in national policies, and also from health sector, health department, Ministry of Health already developed the general adaptation for climate change, but not specific for extreme heat or high temperature, because now priority in Vietnam currently focus in national disaster like floods and storms, and less study and less evidence about the impact of heat. So hopefully for next few years, maybe we have developed the heat health action plan.
Yeah, hopefully. I think also with more evidence and study like this is the input, for heat action plans. So the next question is from Myra. For the heat risk perception studies, how often did you hear that heat is just a part of life and something you have to put up with? How do we combat this sentiment? And that's something we hear a lot in Miami, Florida, where it's hot and humid year-round. And probably the people are all the time saying, we are used to the heat, they don't. I see Rajashree, you're saying, yes. Yes, what do you think?
Yes. So, when I said risk perception, one major problem in areas which have been historically hot, it is very difficult to convince people that heat can lead to risk. So I agree with this person that yes,
Myra.
Myra, that we also have a similar issue, that people who have already seen it, so they say unless you've seen an illness in your family and you've experienced the issues, I mean risk, you have gone through something which has been where it is linked to heat, then you start taking measures. And typically people are taking measures because they're losing out on working days. That means you fall ill, that is not a major concern, but you are not able to go to work and that affects your income. So you start taking measures, not because you consider heat as a risk otherwise, since it's affecting your economic, since it affects your economy, then you start taking measures. So I agree completely that this is a major challenge basically in areas which are historically hot, how to convince people that it is a risk.
And how do you think, how can we combat this?
I mean, you start talking more and more. I'm not just talking about people who are, I mean, the group that we interviewed, but I think whatever my experience has been, even so-called well-to-do people who otherwise also don't get exposed to heat, they think it's just every year it anyways gets hot, so it doesn't matter. It is not anything new. You don't have to speak about it. So unless you create an awareness, I mean, through the government and people who are working the science and the community and people who are working with the community, this awareness is certainly something that we'll have to generate. That's a challenge. I agree.
Yeah, and also what you mentioned in your work is that typical communication campaigns, they talk a lot about what you mentioned, common sense advice. So just, stay in the shade, drink water, and people already know this. You say maybe they don't think it's considered useful because it's not so specific or it's not communicating the risk enough.
Yes, and they already know it. I mean, even my grandmother knows that you need to drink water when it's hot. So what is new about it? So unless you hit, there are two areas where if you hit, I mean, if you are able to show the statistics, people will get concerned. One is if you start talking about health, that it is affecting, show the percentages. Secondly, that is why I brought in that impact on economics. If you are able to tell the world that you are losing out on so many productive days, your income is getting reduced by 10%, 20%, then that sends a very strong message that yes, it is a risk. Otherwise, it's very difficult.
Exactly. Yeah. So the research is super important for sure. Maybe I can move on to the next question, or
Yes.
if anybody else wants to comment on this, maybe Lynn or Efi still wanted to comment on this question as well. Otherwise,
Yes. Just comment about the intervention for vendor is very difficult because they are typically move around. They don't work in the fixed location, so it's very difficult to meet them again and again. They are informal workers, so they have many priorities like the income or the productivity is put a higher priority rather than their health. They know it, but they no way to avoid. They think it's unavoidable. Heat exposure is unavoidable. And I think it's for my study, I work in with a farmer, and they always about heat and perception among farmer, and they say it's unavoidable risk. So they just need to accept it. Being a farmer or being a vendor, they need to accept it. So very difficult to implement the prevention program.
I agree. Yeah, that's also one of the reasons.
Yeah.
There are economic compulsions on these people, the kind of occupation they're involved in. There has to be high exposure. So they can't do anything about it.
Yeah. Maybe I can go to the question for Efi. So you mentioned mental barriers to see heat as risk. Did you find any connection to other factors to explain it?
Yeah, and when we talk about the notions of risk, yeah, this is kind of long-standing topics, yeah, and it is quite complex, yeah, very subjective, and but from this approach that I use from the trophics theories, I can found that for these forestry workers, for example, they tend to accept the risk because they used to face the more immediate risk. This extreme heat exposure is, we can say, this is kind of slow onset. They're exposed for today or this month. They will not directly get sick or ill, but if get injured from other trees, for example, when they cut the trees and they get injured due to the chainsaw, for example, then they directly will get injured, severe injured. They will believe that, okay, this is very risky, but this is different with this heat risk exposure, extreme heat exposure. In Indonesia, we don't have a heat wave yet, but the temperatures getting increase and increase, and we have very high humidity, and this is not good for our health. Yeah, actually, and then what I mean is for people who face immediate risk, who used to face immediate risk, which is not slow onset risk like this heat exposure, I agree with what Lynn and Rajashree said that it will be quite difficult. So we need extra and more intense efforts, yeah, to make them aware about the risk of this heat exposure. Yeah, I think that's what I can say.
Thank you so much, Efi. And yeah, we're